promote optimal activity like exercise, rest, and sleep.
Exercise benefits. First, reduces body fat.
Fat stores energy that your body can use. When you exercise, your body uses more energy, so fat burning can occur. However, there is a balance of energy in and energy out. If you eat more calories, which cause you to store fat, you need to increase your exercise in order to burn the stored fat that you made.
Second, increases lifespan.
Staying fit can make you healthier so you can live longer and feel better. Exercise improves blood circulation all throughout the body. This means that your heart, lungs, organs, and muscles are all working better.
Third, oxygenates body.
During exercise activity, you repeatedly move large muscles in your arms, legs, and hips. You will notice that your body responds quickly. You breathe faster and more deeply. This maximizes the amount of oxygen in the blood. The heart will beat faster, which increases blood flow to the muscles and back to the lungs.
Fourth, strengthens muscles.
Exercise is any activity that makes your muscles work harder than usual. That builds and strengthens muscles, which can protect the bones from injury and support and protect joints. Strong muscles also give stability and improve balance and coordination.
Fifth, manages chronic pain.
Exercise is a common treatment for chronic pain. Depending on your current state of health, it may help decrease inflammation, increase mobility, and decrease overall pain levels. No additional medication is required.
6. Ward off viruses.
Aerobic exercise activates your immune system in a good way. This may leave you less susceptible to minor viral illness, such as colds and flu.
7. Reduces diabetes risk.
Exercise benefits people with diabetes and those at risk for diabetes by helping them manage their weight and improving their blood sugar levels and heart health. For a person with diabetes, exercise is just as important as diet and medication.
8. Strengthens heart.
Exercise strengthens the heart. A stronger heart doesn't need to be as fast, but a stronger heart also pumps blood more efficiently, which improves blood flow to all parts of your body.
9. Clears arteries.
Aerobic exercise boosts the good cholesterol and lowers the bad cholesterol. This may result in less buildup of plaques in your arteries.
10. Boosts moods.
Aerobic exercise may ease the gloominess of depression, reduce the tension associated with anxiety, and promote relaxation that boosts your mood. It can also improve your sleep.
5 benefits of taking a rest day. 1. Prevents injuries. 2. Prevents mental burnouts. 3. Allows body to replenish energy stores and repair damaged tissues. 4. Prevents illness. 5. More free time. Here are the 6 tips for healthy sleep. Number 1. Schedule. A consistent bedtime acts as a signal for you to start falling asleep. Number 2. Duration. Maximum of 7 to 8 hours. After 16 hours, your body and mind needs to be recharged. Number 3. Limit and avoid. Intake of caffeine, alcohol, and nicotine are all interfere with achieving quality sleep. Number 4. Relax. Get cozy and comfortable. Read, listen to music, or take a hot bath close to bedtime. Number 5. Environment. Keep your bed dark, cool, and gadget-free to promote optimal sleep cycle. Number 6. Activity and daylight. At least 30 minutes of exercise and sunlight each day regulates circadian rhythm.
To promote the safety through prevention of accident, injury, or other trauma, and through prevention of the spread of infection.
The hospital and healthcare professional will ensure that you will be safe during your stay.
Safety tip number 1. Don't try to get up by your own. Use your call button and the nurse will respond as soon as possible. Safety tip number 2. Don't ask family members or friends to help you get up. They are not trained to walk you around. Your care teams are. Safety tip number 3. Patients often fall while reaching for items on their hospital tables. Make sure your phone, glasses, and magazines are within reach.
Safety tip number 4. Hospital floors may be slippery, so your nurse will provide you proper footwear to avoid falls. Safety tip number 5. Accident may happen in the bathroom. That's why your nurse must be with you during those times to ensure that you will not fall. Safety tip number 6. Do not use an IV pole, tray table, or wheelchair to help you get out of bed, because these things are not designed to walk you safely. Instead, these equipments may cause you to fall.
Prevention of infection spread. Why is hand washing so important? It is important because it is life-saving.
Frequent hand washing with soap and water is the key to prevent the spread of infectious disease such as COVID-19. Your healthcare team will ensure that you will avoid falls and spread of infectious disease so that you may recover quickly.
To maintain good body mechanics and prevent and correct deformity. Clients may be reluctant to move or may stay in bed unnecessarily. This immobility can contribute to a number of disorders, among which are pressure ulcers, blood clots, constipation, muscle weakness and atrophy, pneumonia, joint deformities, and mental disorders. By assisting clients to maintain or regain mobility, you promote self-care practices and help to prevent these complications.
Including promoting comfort, restoring body function, preventing deformities, relieving pressure, preventing muscle strain, stimulating proper respiration and circulation, providing diversion, and giving nursing treatments.
The client's understanding is important because he or she will be more likely to maintain the new position. If he or she can help, explain how. The client's assistance will save strain on the nurse and will give the client some exercise, increase independence and self-esteem, and instill a feeling of control.
This consideration is especially important for older or immobile clients. Some conditions do not permit turning the client, such as fractures that require traction appliances. In other conditions, such as unstabilized spinal injuries, turning may be harmful. In most other conditions, turning is helpful and encouraged.
Although not commonly used, in some cases the client who cannot turn is placed in a circle bed which rotates the client from head to toe, or on a striker turning frame which rotates the client from side to side. More commonly, this client is placed in a rotating or oscillating bed, a flotation bed, or other special type of bed.
Be sure to request help from another person if the client is heavy, or if you are unsure that you can move the person by yourself. It is also important to be sure you know how to use special equipment for moving and lifting clients before use.
Facilitate the maintenance of a supply of oxygen to all body cells.
It is important to maintain homeostasis, and to do that is to maintain a proper diet and exercise, like eating green vegetables, because it has chlorophyll and it has the same structure like our blood, and maintain good posture for proper distribution of oxygen to the body, because slouching prevents your diaphragm from working efficiently to expand your chest cavity and lungs.
A person
patient manifests breathing problems. Oxygen shall be attached to a patient, usually via nasal cannula. Sedated patients then are attached to cardiac monitor and pulse oximeter, all the while having the oxygen delivered. Then, when the oxygen saturation falls below the normal levels, the rate of oxygen is increased accordingly.
To facilitate the maintenance of nutrition for all body cells. Nurses have the expertise and responsibility to ensure that patients' and clients' nutritional needs are met. Providing nutrition screening and appropriate nutrition advice is essential to improve healthy eating and subsequent health outcomes.
Nurses play equally important roles which complement the role of the dietitian to ensure adequate nutrition for patients. Nurses often fill the role of nutrition counselors by providing nutrition screening and or nutrition advice to patients.
Nurses play a significant role in understanding the importance of nutrition basics and need to be able to explain the facts about healthy foods choices to patients. They are expected to deliver healthy diet education.